Let's talk about radial keratotomy and cataract surgery, or trying to actually fix or help radial keratotomy with either cataract surgery, lens exchange, or even ICL. These are all methodologies of changing the lens in the back of the eye to compensate for the refractive error, the prescription, the farsightedness or hyperopia and astigmatism caused by the radial keratotomy. These don't fix the irregularity in the cornea. The irregularity is what causes the ghosting, the streaking, the multiple images, the distortion of images, the distortion of light that can cause visual loss. It doesn't fix that. It fixes the refractive error and gets rid of the clouding of the cornea. Sometimes that's pretty important. And for eyes that are not too irregular, it works pretty nicely. When patients have the RK and they want to get the cornea, the irregularity removed, what we recommend is we do the structural fix where we fix the shape of the cornea. And what we normally do, our protocol is 4 months later, we do the final refractive error tuning, get rid of the final correction that's left. And so what we recommend our patients do is have the cataract surgery in between 4 months. And that usually allows that cataract surgeon to adjust the refractive error even closer. And in a couple patients, the surgeon was really good, and we managed to get ourselves a patient that had virtually no correction at all and didn't need very much on the phase 2. And so that's really it's really worked out very, very well for our patients. But do understand that some of these premium lenses may not be that effective trying to fix a irregular astigmatism caused by an irregular cornea in a radial keratotomy patient, and trying to fix that with a regular astigmatism intraocular toric lens may not work out very well. It may not be very effective, and in fact may create a new distortion. And then when it comes to the multifocal lenses that allow you to read, the problem is when you have an irregular cornea that's scattering light, do the multifocal lenses work well or not? I think there's too much risk that it will not work. And so I really don't recommend toric or multifocal lenses for RK patients. I really recommend that they just get the basic acrylic IOL that the insurance covers. And if they have had cataract surgery and continue to have visual issues, then of course we can reconstruct the cornea to help with that. In other words, you've already had cataract surgery. But I just, it's difficult to say that a lens surgery is going to completely fix the problems with RK when it is not directly addressing the irregularity the RK caused.